professional if my patient had any contractures or if there were any issues that would prevent me from completing this task by myself. So now that I see that you have none of those things going on, I want to assess your skin, your perineal area. I want to assess for any bladder distension. I don't see any bladder distension. As I'm looking at your perineal area, there are no signs of skin breakdown, no redness, rashes, lesions, or exudate. Your skin is clean and intact down here, so I do not need to do any further cleaning. It seems as though you've already had your bath. So now that I have assessed your perineal area, I want to be able to now move on. I can cover them as much as I can, and then I'm going to move on to my sterile field. So you can come over here now, and I have lowered the patient's side rail on the side that I'm going to be working on, and I have my my things for hand hygiene here. So before my hand hygiene, I have all of my supplies here. And my Foley kit was verified when I walked in, but as I'm looking at it again, I want to make sure that it's completely verified. So it's a 14 French. I will verify that with the doctor's orders, and it is not expired from what I see, or from the date. And now I am going to identify which hand is my dominant hand. So my right hand is my dominant hand, my left hand is my non-dominant hand. They're both going to stay sterile through this first part of the procedure, and then I'm going to lose the ability to use my left hand. So now that I'm sterile, I am going to remove the contents from my bag. So I'm going to use my bag as a trash receptacle. I'm looking, and since my bed doesn't have a, it's not double-sided, I'm gonna have to move my patient to the correct side of the bed. Okay, so that I can maintain that sterility when I am over here with my dominant hand and my non-dominant hand placement. I'm gonna hand hygiene this again, and we're gonna get into this Foley kit, okay? So again, my tray, my clean surface, this is a clean surface, is at waist level so that I don't contaminate. I am not going to cross over any of my products or my sterile field. I will simply throw away. Come back. And so now I want to make sure that my sterile field is set up properly for when I use it. So I am going to touch within the 1-inch margins, and I'm going to pull. I'm going to, the side that was away from me, I pulled first. I'm going to pull the sides out. The side out, and then I am going to pull the flap closest to me. Okay, and so now I'm just going to adjust my sterile field so that I have room. Okay, so now I have my, again, I never want to cross over, so I'm going to always stay, I want to say stay in my lane, but stay within the specific margins. So I'm going to don my sterile gloves over here, and I am going to get rid of the things that I don't need. So my drapings, because we won't be using that. Yeah, won't be using that. No, won't be using it. Okay. And so